Good day, everyone. My group and I will have a discussion about the healthcare system and the differences in how they deliver between the Philippines, Canada, and the United States of America. Next slide, please. This discussion is divided into different sections. First, let us have quick discourse on the definition of a healthcare system. Next is the generic economic resources of the three countries mentioned earlier, followed by their economic performance and their health status. Finally, we'll have an analysis on the data that will be presented. Next slide. What is a healthcare system? A healthcare system is the way in which all health services are provided, from how they are financed, the workforce, facilities, and supplies available. A strong health system will ensure that everyone is able to access high-quality healthcare without financial difficulty. Healthcare is conventionally regarded as an important determinant in promoting the general physical, mental, and social well-being of people around the world, and can contribute to a significant part of a country's economy, development, and industrialization when efficient. Therefore, health systems have different outcome-oriented objectives, including health utility, process utility, and financial fairness. Next slide, please. Now we will discuss the data that has been collected regarding the generic economic resources of the Philippines, Canada, and the United States of America. But before that, let us have a quick discussion on the definition of terms in this table. Gross National Product, or GNP, is the total value of all finished goods and services produced by a country's citizens in a given financial year. The GNP per capita, on the other hand, is the dollar value of a country's final output of goods and services in a year, divided by its population. The Gross Domestic Product, or the GDP, measures the monetary value of final goods and services, that is, those that are brought by the final user, produced in a country in a given period of time, while the GDP per capita measures a country's economic output per person and is calculated by dividing the GDP of a country by its population. Now let us proceed to the actual data. Philippines' gross national product was reported at 100.311 United States dollars in March 2022. Canada's gross national product was reported at around 500.152 billion US dollars in March 2022. United States of America's gross national product was reported at 6,157.402 billion US dollars, or approximately 6 trillion US dollars in March 2022. The gross domestic product in the Philippines was worth 361.49 billion US dollars in 2020, according to official data from the World Bank. The GDP value of the Philippines represents 0.32% of the world economy. The gross domestic product in Canada was worth 1,644.4 billion US dollars, or 1 trillion US dollars in 2020, according to the official data from the World Bank. The GDP value of Canada represents 1.45% of the world economy. The gross domestic product in the United States was worth 20,936.60 billion US dollars in 2020, or approximately 20.9 trillion US dollars, according to the official data from the World Bank. The GDP value of the United States represents 18.55% of the world economy. The Philippines' GNP per capita for 2020 was 3,430 US dollars, a 10.91% decline from 2019. Canada's GNP, on the other hand, for 2020 was 43,440 US dollars, a 6.5% decline from 2019. The United States of America's GNP per capita for 2019 was 65,920 US dollars, a 3.78% increase from 2018. The Philippines' GDP per capita for 2020 was 3,299 US dollars, a 5.35% decline from 2019. Canada's GDP per capita for 2020 was 43,242 US dollars, a 6.66 decline from 2019. The United States of America's GDP per capita for 2020 was 63,544 US dollars, a 2.66% decline from 2019. More will be discussed by the next reporters.
Good day, everyone. I will be reporting the total expenditures for health for the Philippines, Canada, USA. First, let's define total expenditures for health. Total health expenditure is the sum of public and private health expenditures. It covers the provision of health services, preventive and curative, family planning activities, nutrition activities, and emergency aids designated for health but does not include provision of water and sanitation. The total expenditures for health of the Philippines in the year 2020 is about 1 trillion Philippine peso, while in Canada, the total expenditures for health in the year 2020 is 308 billion US dollars, while in the US, their total expenditures for health in the year 2020 is about 4.10 trillion US dollars. Now let's proceed to the per capita health spending. Per capita health spending means it is the health spending per person. So the per capita health spending in the Philippines is about 8,000 pesos per capita, while in Canada it is 8,019 US dollars per capita, and in the USA it is said to be 11,945 US dollar per capita. I will now give the floor to the next reporter.
Good afternoon, everyone. I'm going to report the total labor force in the Philippines, Canada, and USA. First is unemployment rate participation in the Philippines in October 2020 to January 2021 was 8.7%, and it was lowest since April 2020, but it was higher in January 2020 at the rate of 5.3%. In Canada, it fell to 5.1% in May 2020 from 5.2%, and in USA, May 2022, the rate remained at 2.6%, that is according to the Bureau of Labor and Statistics. Next is labor participation rate in the Philippines. In January 2021, 60.5% was placed. Around 45.2 million Filipinos that are at the age of 15 years old had a labor force participation rate. 61.7% was lower forced labor, but 58.7% was higher at the same age. In Canada, average 65.62% from 1876 until 2022 have a labor force participation rate and also reaching 67.70% in December 2003, and in April 2002 has lower 60%. In the USA, both labor and unemployed participation rate is 60.1%, and both also measured 1.1 percent points below February 2020. The US reached 164.6 million people in February 2020 when the COVID-19 started. Last is employment rate participation in Philippines. In Philippines, January 2021, 93.1% stood as the employment rate. That same in October 2020 rate of 41.2 million people was employed out of 45.2% of the Filipino labor force in January 2021, and it reported lower 94.7% in January 2020. In Canada, 84.6% was employed. Men fell 0.6 percent point to 88.0%, and women rate at 0.5 percent points at 81.2%. That was recorded high observed in February. The Canadian labor force will continue to expect to increase from 19.7 million in 2017 to 22.9 million in 2036. In the USA, 60.10% was increased in May from 60% in April 2022. Next, I'm going to report about the total number of hospital beds in the Philippines, Canada, and USA. First, in the Philippines, the country has 105,000 hospital beds, and the beds density is 4 per 1,000 population. In Canada, their hospital beds stood at 6.75 per 1,000 inhabitants by 2019 and 2.5 per 1,000 population. In the USA, they have 1.5 million total hospital beds, but in 2019, the number drops to 919,000 beds. And that's all for my report. Next reporter, please.
I am Glyza, and my report is all about the comparative health status that includes life expectancy and crude death rate between Philippines, Canada, and USA. So life expectancy is the rating that tells us the average number of years of life a person who has attained a given age can expect to live. And life expectancy is based on an estimate of the average age that members of a particular population will be when they die. So in the Philippines, the life expectancy rate is 71.53 years. In Canada is 82.81 years, and in USA is 79.05 years. So proceeding to crude death rate. So crude death rate indicates the number of deaths per 1,000 mid-year population. Crude death rate indicates the number of deaths occurring during the year per 1,000 population estimated at mid-year. So the crude death rate of Philippines is 6.105. In Canada is 7.894. And lastly, the USA is 9.075. The rest of this will be reported by AJ Ismanilla. Thank you.
Good afternoon, everyone. I am AJG Sponilla, and I'm going to continue the report of Miss Habinas. So, for the mortality rate, in the Philippines, there are 17.958 deaths per 1,000 live births. In Canada, there are 4.55 deaths per 1,000 live births. And in USA, there are 9.75 deaths per 1,000 live births. Lastly, for the morbidity rate, since morbidity is a general and a wide topic, we centered it on heart diseases. So in the Philippines, there are 192.11 cases for every 100,000 population due to heart diseases. In Canada, there are 191 cases for every 100,000 population due to heart diseases. And lastly, there are 198 cases for every 100,000 population due to heart diseases.
While the three countries have their own respective medical healthcare agencies and policies that are enacted to ensure high quality healthcare to their respective citizens, it is clear that their economic resources are significantly different from each other. In terms of economic progress, the United States of America really advances themselves by a mile. Canada sits at the second place for the three countries, while the Philippines lags behind the two. It is also crucial to note that the United States of America accounts for more than 18% of the global economy, making way for more investors and hence a flourishing local economy. Based on research and data from the three different countries, we can also say that both Canada and the Philippines have a similarity in how much they invest their money on healthcare research and services. The Philippines spends a little bit less than Canada on healthcare, however, the United States is ahead of the two countries investing and spending on healthcare the most. In terms of unemployment rate, the United States of America seems to suffer the least out of the three countries, with its unemployment rate remaining at 2.6%. Canada sits in the middle with 5.1%. The Philippines has the highest unemployment rate at 8.7%. The tables have turned though in the three countries' employment rate, and the Philippines have the highest rating of employment rate at 93.1%, followed by Canada at 84.6%, and finally by the United States of America at just 60%. Higher healthy life expectancy is significantly connected with higher employment rates. On average, for every 10 percentage points higher than the employment rate, healthy life expectancy is roughly 5 years higher. In the Philippines, the hospital bed density is at 1.2 per 1,000 population, which is the lowest of all the three. This is followed by Canada, which has 2.5 per 1,000 population. The United States of America has the highest bed density at 2.8 per 1,000 population. The Philippine government should invest more in increasing the hospital bed capacity, not only to catch up with bigger countries, but to provide better and comfortable healthcare to its people. Due to rising inpatient care expenses, limited resources, and rising demand for hospital care, hospital capacity planning is a critical issue in many industrialized and developing nations. The number of years a person may anticipate to live is referred to as life expectancy. Life expectancy is defined as an estimate of the average age at which members of a specific demographic group will perish. At the health status of the three countries, Canada seems to be taking the lead. Canada has a life expectancy of 82.81 years, while the United States of America has a life expectancy of 79.05 years. Canada also has the lowest morbidity and mortality rate. The United States of America sits in the middle. The Philippines has the highest morbidity and mortality rate out of the three. The Philippines has the lowest life expectancy at 71.53 years. According to Dr. P.J. Devereaux, a researcher at McMaster University, studies of patients with end-stage renal failure demonstrate that Canadians survive longer than Americans because their care is of higher quality. According to him, for-profit health clinics in the United States spend more on marketing and less on skilled employees. While the Philippines has a nationalized and government-controlled healthcare system, it is insufficient to meet the needs of its citizens. Upon doing this analysis, we have come to a conclusion that each country has their strengths and weaknesses when it comes to their healthcare system, and there are definitely countries that outperform others. However, in this comparison, it is slightly unfair to the Philippines to be compared to Canada and the United States of America, which are both economic giants with a head start at their own technological advancements in the medical history. However, all of these countries can certainly do more to provide better healthcare systems and services to their citizens. For instance, the healthcare sector might drastically enhance healthcare quality by implementing greater openness and compelling practitioners to utilize patient-centered EHRs that are publicly available to all care providers and the patients themselves. Improving the healthcare system is not only beneficial to one specific country, it is beneficial to all. It raises health standards and serves as a stepping stone for others to improve their healthcare systems as well. Overall, increasing healthcare quality and performance may give providers with dependable, cost-effective, and long-term healthcare procedures, allowing them to achieve their aim of improving care delivery and patient outcomes. Thank you for listening. We hope that you have gained some insights in our discussion.